Hi, I'm Justin Ott, founder of Ott Physical Therapy and physical therapist, joined here today with a good old friend of mine, Luke Novosel. Can you give a little introduction of yourself?
Yeah, Justin, thanks for having me on. So I went to physical therapy school at University of Pittsburgh, obviously where we got to meet each other, which I guess kind of extended a little bit before that, working at good old Presbyterian Hospital in Montefiore as a rehab aide, which kind of goes way back now at this point, which is kind of crazy to think about. But obviously went to PT school at Pitt, like I mentioned. And then after PT school, decided to continue on for some continued education and did a sports residency program at Houston Methodist down in Texas. Had an awesome experience there. Got to work with a ton of fantastic, sports physical therapists, athletic trainers. Worked with a ton of the different sports teams in Houston, and that kind of fueled my passion to want to continue my professional development. And I decided to go back to athletic training school to get my master's degree, and I did that at Boston University and had an awesome experience there. Again, worked with a lot of great sports teams, met a lot of great athletic trainers, and just continued to try to expand my skill set and knowledge base to the best of my ability. And then after that, I started with the New York Mets primarily as a physical therapist at our spring training complex in Port St. Lucie, Florida. And then eventually became their minor league rehabilitation coordinator, where I kind of oversaw any injuries that happened in the minor league system, and then also assisted with some major league rehabs as well. And then this past year, um, I got a new opportunity with the Pittsburgh Pirates, which is where I'm from. So it's kind of awesome to be able to come back home, work with my hometown team, a team that I grew up with and, grew up going to the games and obviously been a huge baseball fan and advocate my entire life. So it's kind of really cool to see all that stuff come full circle in my current role as a Major League physical therapist and assistant athletic trainer with the Pirates. So that's kind of where we're at currently mid-season, going through some ups and downs in the season like anybody, does at time, from time to time. But excited for the role and, excited to see what's in the future.
It's an awesome full circle to see where you started, where you went, where you're coming back to, and I'm looking forward to see where the career goes for you with that. But going into baseball, I played baseball at a competitive level, but it was my youth, so I never made it past middle school. Everyone just shot up to 6 foot tall, and I just couldn't keep up with them, and those pitches were getting too fast. But I know that you played into your collegiate career. So can you tell me a little bit how the competition changed from you as you got into the University of Pittsburgh and started playing there?
Yeah, for sure. I mean, this was obviously many, many years ago now at this point, but I think for me, the biggest difference that I noticed was everybody, at that time at the Division I level, all those players, all those guys were all the best on their high school teams. And while it was one thing to be a standout in high school, I think I found it to be even more challenging, at that level where you're surrounded by so many talented individuals and where everybody is kind of at your level or above your level. So it's kind of figuring out how to kind of stand in or stand out, among so many other talented individuals, at that level. And, not to mention how difficult it can be to be a full-time student athlete, where you're a full-time student and full-time athlete and being able to juggle the demands of both and really trying to give your all and your 100%, knowing that you can't always give your 100% to both just because of, the demands of both. And I think also the added pressure that comes from playing at that level. And obviously each level you go up, whether that's Division I, whether that's to professional, it's like every level you go up, that pressure and that level of competition just continues to grow and grow. And obviously I've seen that now from a different lens, being a provider at the professional level, not making it as a player, but I feel like every level I've gone up, that pressure and that level of competition obviously kind of increases exponentially with each of those. So I think those were probably some of the biggest differences, that I've seen. And just from where I've been back when I was playing, I mean, I think the game has changed so much now with, the implementation and use of weighted balls, which has gained so much traction both in the literature with the youth populations, the incidence of UCL injuries, and really just elbow and shoulder injuries as a whole. I mean, the analytics in the game now is huge, where it's all about your emphasis on pitch design, velocity, development of new pitches, spin rates, all those things. And with that, it's like guys are, kind of having to throw the ball as hard as they can to figure out ways how to, kind of manipulate, their pitches to try to meet these advanced metrics to get flagged by these scouts and then, to try to get drafted or signed to a Division I school. So I think it's, all of that stuff really wasn't in the game back when I played.
Yeah, I sat down with one of our coworkers and old coworkers, and we were talking about youth sports, and it always amazed me how much it's advanced, even from when we were kids. It's come a long way. I played soccer competitively. That was my sport growing up. But even to the degree of what I'm seeing kids do today is not nearly as intense as what I was used to. And we were in a pretty competitive, highly ranked team when we were playing. We travel across the world and everything to do that, but it's a whole different level. And I got plenty of injuries playing when I was younger, so that's one thing that stood out, that at a competitive level, you're at a higher demand, your body goes through more strain. So if you're not prepared, and even if you are, you can hit some of those injuries. So during your playing career, do you have any significant injuries or setbacks? And if so, what was it like returning to sport for you?
Yeah, no, I think the biggest challenge I think I had with trying to keep myself healthy was, just the difference in demands of trying to be the full-time athlete and full-time student at the same time and having to be able to juggle those, which I think it's something that I personally struggled with, obviously going through kind of the undergrad that we have to go through in order to get to PT school. With all the labs and different sciences and whatnot, that obviously are pretty time intensive and challenging courses. I think I didn't really spend looking back on it as much time, toward the recovery aspect of things as much as what I would have liked to. Unfortunately, I didn't have any major, quote unquote, major injuries while I was playing, but my junior fall, I developed a slab tear and just some pretty significant internal impingement, which led to a significant decline in my, throwing velocity and subsequently my performance. And that didn't kind of put me in a tough position going into my junior year, into the actual season. And, it's one of those things that just from there, just everything kind of seemed to, decline. And we tried to treat it conservatively throughout the season. And unfortunately, I wasn't able to get through the years as I had hoped. So it was kind of really that first time where I could hit a significant kind of injury bug that was really influencing how I was performing, had done fairly well my, freshman and sophomore year. And you kind of hit that and get the injury bug and it kind of comes at the wrong time. And kind of everything, kind of spiraled from there. And I think after that season, I was kind of faced with a tough decision where, they were going to take my scholarship away, from my senior year. They were going to give me an opportunity to get it back in the fall if my velocity had and just overall performance was kind of up during fall ball. And, unfortunately, had to, at that time, knowing where I was in my career, what I was looking forward to, academically and kind of professionally moving forward, that I made the tough decision to kind of, to step away from the game, at that time and just refocus my attention on my academics and determining a path of how I could reach, my goal of being in the major leagues, or really getting to professional sports, as a staff member in the future versus as a player. So it's kind of refocusing and reshifting that focus to something, a little bit more tangible and something that I felt was, probably more realistic in my future career path.
That's a tough one. I know whenever I'm thinking of a shoulder injury or the baseball player, the first thing that comes up is Tommy John surgery, UCL, and having to worry about that. But anytime I work with a shoulder injury, I'm doing an assessment. As soon as I see those clinical signs for a labral involvement or something, it makes me kind of cringe because that's going to be a tough one to bounce back for. So that's a
Yeah.
tough injury to have to deal with. But I'm glad things are still working now. You're still getting on the field, getting to see all the
Yeah.
ballparks. So it's the pros and cons of it too. So and hopefully you're at less of a risk of an injury going in as you get older too. So that's always a good thing to look forward to.
Sure.
Now, I've had the opportunity to work with a lot of professional players, but not with a professional team. When did you know working with the professional athletes was something you wanted to pursue? It sounds like you knew it as soon as you had the injury, but it was still a path that you wanted to take.
I knew I wanted to go into, the field of physical therapy from what I would say probably a pretty young age. I was probably 12 or 13. My aunt owns a physical therapy clinic that I was kind of exposed to pretty early. She works with a lot of high school kind of youth athletes predominantly, a lot of just general population too. Weekend warrior type athletes. And, I thought that was really interesting and fun. And so I always knew that that was, a career that I was extremely interested in, just being able to watch and shadow her, be around her and kind of see what she got to do. So it's always I knew that was a specific interest of mine. And then, I think as I started getting older and, playing more competitively in sports, I just developed a passion for sports. And, I think that was where that's kind of fueled everything. And when I couldn't, when my playing career ended sooner, as everybody has the career of playing professionally, right? Every time any young kid growing up, whatever sport you're playing, you want to play professionally. It's like you want to be in that setting and kind of take your your level of play and talent to the highest level. And obviously for a lot of people, that doesn't work out that way. So I think once, I was so motivated to wanting to get to that highest level, of professional sports that, when that ended for me, I felt like I just still had a piece of me that wasn't fulfilled. And, I always thought that, it would be fulfilled if I could ultimately get there and, get paid to be on the field, on the sidelines, in the dugout, whatever it may be. And, fortunately, that's kind of where it ended up now. But I think that didn't come without an extreme sense of getting there through, having a high level work ethic and kind of desire to maximize my growth and development as a clinician. I mean, going into a residency, taking a pay cut, doing that, then going back to school to get a master's degree. I mean, it was I think a little bit of a unique path, especially as the athletic training field kind of transitioned from an undergrad bachelor's degree to a master's degree, and having to really, for me, have the longer term vision in mind and really have the support of my family to do what I wanted to do, knowing that, this is, I'm thinking more down the road as opposed to thinking more short-sighted, and making the necessary sacrifices to make that happen. But I think for me, it was just kind of recognizing it at a young age. And, I really loved working with people and loved the, profession of physical therapy. And then just ultimately just love being in sports. And for me, getting paid right now where I'm at in my life, like to get paid to be in the dugout every day or to be on the sidelines, like is one of the coolest things ever. You obviously there's a lot of sacrifices that you and your family and everything you kind of put that go into being in at this level. But, at the end of the day, it's like you accept those challenges, just knowing, for the real reason of why you're here and why you do what you do, because, you love what you do, So I think for me, that kind of helped to get me to this point. But I think what I did kind of some things I alluded to, which I'm a huge advocate for sports residency programs. I mean, I know what my sports residency program did for me. I'm a Houston Methodist, was phenomenal in terms of providing me, awesome mentors, people that were paid to mentor me. I mean, it's like where do you go in after you graduate when you come out a generalist and you're trying to want to focus on a certain area, and it's you don't always, the clinicians around you don't always have the time, desire, or anything to kind of really help to guide and develop you. And it's like you go to a sports residency program and, everybody there, the whole program is geared toward putting you in the situation to promote your development, to teach you how to be a little less of a generalist and more of a specialist down a certain path, which in this case was sports, and put you in different situations with athletic trainers in the athletic training room, on field, learning how to do end stage rehab with various athletes, not just one specific sport, but kind of across the board. So I think all of those were extremely valuable things that helped to, almost accelerate my learning and my knowledge and my skill set, and you know, um, and kind of put that into a year where I just worked my butt off and really learned, kind of what it took to be in and succeed both in the clinic, working with an athletic population, but also, working in the athletic training room and on the field as well, and also identified how much I still had, how much I still didn't know, and how much I still had to learn. And I think that ultimately fueled and motivated me even more, working with all the athletic trainers around me and seeing what they could do on the field, on the sidelines, in the dugout, in the athletic training room. And those were all areas that, you get exposed to in residency, but you don't really truly learn and don't actually go to school for. So I think that only further motivated me to, to go back to school so I could, try to learn as much as I could and fill as many of the knowledge gaps as I could to set that foundation. So I knew wherever I went from there, as long as I was surrounded by good people that could continue to foster my development and keep learning and growing. It's, I think that's always the mindset I've had. And I think some things that I've learned or, through the path that I've taken, to help to get me to this point.
Yeah, I got to say, graduating is one thing. You come out with all the tools to start building a career. Most useful things for me has been those continue education, getting good with my hands, getting that repetition, getting that confidence up. We talked to my friend Mike, our friend Mike from school too, who he went to Ohio State to be working there as a residency program, and he stuck in with being almost a mentor to the residency program into his career. And he's a huge advocate as well. And it always stood out to me. I remember in Pittsburgh, like you've come a long way from us being in the hospital down there, building up just your bedside manner, always fantastic with it. But then you start really catering to what you want to do, your education, your skill set. It always stood out to me sitting in at the Steelers complex when with the resident at that time was giving a whole presentation about throwing, about the shoulder, and he brings in little things like, and that you got to think about the hamstring activating. So it's the whole body approach, and it gets really in depth. So it's not just this muscle, you got to stretch it and strengthen it this way. It's how do you dynamically fix the entire body so you don't have to deal with re-injuries or anything going about it. And like I say, shoulders have always been one of my favorite joints. It's just so complex, the coupling of all the muscles, to be able to rehab it back. And there's always something new and dynamic. Are there any favorite things that you have about shoulder rehabilitation and athletes? And what kind of protocols or guidelines stand out that you contribute to your approach to treating at this point?
For me, how dynamic, just the shoulder complex is just fascinating. I mean, for me, treating the shoulder and elbow has kind of always been, probably my favorite, joints to work with. And I think just how interrelated the shoulder is with its degrees of freedom, interplay of the scapula, the thorax, the spine, how it creates a stable base that really sets the foundation for the throwing movement, and how really any little imbalance in the shoulder can set the stage for a number of throwing related injuries and issues. I mean, when throwing is such a sequenced movement and everything has to be on time, it has to flow and has to work, in conjunction with each other. And when you have any little imbalance or any little thing that's off, I mean, just really can throw, can lead to an injury. And I think for me, trying to actively or to identify what those are, and to really learn how to address, how to maintain a happy and quiet shoulder and something that's stable and, engaged and balanced and whatnot is especially in my role now, which 50% of my role, is that, which is trying to determine programs and manual therapy techniques and arm care programs that are individualized to each athlete to help to keep them on the field and obviously prevent injury and keep them off the IL. Because, with the Pirates, we need everybody just to try to get wins. We don't have the luxury of, of buying players or to signing big free agents. It's like we need to develop and promote guys. We need to keep them healthy. And, that's kind of a big focus, that we have. So for me, it's like working through those interrelated parts and the dynamics of the shoulder and elbow complex is extremely fun and fascinating, to me. And I think, for me, what I've learned, especially getting into professional sports where you kind of everything that happens, you get imaging. For me, I think what I've learned is, first treat the athlete and not the image. I mean, obviously the imaging is extremely supportive and helpful and, probably a little unique to the professional sports setting to really have imaging on pretty much any injury that happens, because obviously realistically in in most other areas of the profession, like you're not going to have that luxury. But for me, it's treat the athlete, not the image, and the image is there to support and help to guide, and obviously creates a good feedback loop of communication with the MDs and kind of other key stakeholders that are involved in the process of developing a diagnosis, prognosis, and kind of return to play timeline. That those are obviously extremely helpful. But for me, in addition to the image, look at, tissue specific factors, their past medical history, any psychosocial factors, acute and chronic workloads, timing of the year, for the athlete, and their sport specific demands and role on the team. And for me, it's like all those things when we have an injury, those are all things that, I kind of look at, whether it's post-surgical, just a non-operative injury. Those are some of the factors that I'll look at, that we'll sit down as a team to discuss, to kind of determine what that return to play process and timeline is going to be. Because ultimately that's what front office, that's what coaches want. They need to understand no matter what the injury is, which is obviously the hardest part, because medicine, everything we do is gray. There's not a lot of like absolutes and things, but they want answers and they want prognoses and timelines and return to play rates quickly. So that's where obviously the literature comes in that kind of helps to kind of guide some of the return to play rates and helps to influence some of our timelines. But it's also just taking all those factors that I mentioned, kind of being able to synthesize and discuss those quickly to be able to, give the information to the right people, to make sure that they're informed and they can make various roster moves that all happen like that. I mean, professional sports things happen quickly. People need answers yesterday, when an injury happens. So it's kind of figuring out how to get ahead of those and to, be as good with your communication amongst the team that you can, and including the athlete into that and their agent. And you got all these other factors that come from that side of things, and figuring out how to, establish what the right return to play kind of process and timeline is.
I love you say a quiet and happy shoulder, and then these guys come out throwing 90 miles per hour fastballs on you.
Yeah.
That's not too quiet to me. But another thing you touched base on that really resonated, and it takes me back to like the days of the musculoskeletal classes where imaging isn't everything. And this is something that stood out to me in an outpatient, not professional, but I get a lot of people coming in, I need that MRI. Like, how are you going to know this? And I will say that's something with our profession. I'm sure you see it that you have eyes beyond the MRI. You can see things and treat the impairment. Not to say that the imaging isn't exceptionally helpful in a lot of cases, really know what's going on to an in-depth level, but to see how it's really relating to your function, how it's impacting you, and the rate of rehab or how to go about rehab. I think that physical therapists have such an outstanding leverage on being able to make some of those clinical decisions that can really make a good impact on people. And it can be way more valuable than MRIs in a lot of cases. And not to discredit MRIs or say that they're not a useful tool, but definitely your knowledge, your background is something that's invaluable. That's nothing that can. You sit there for a static image, it's not going to tell you as much as what you can see about the person's movement, their activities. So I think that's very helpful to know too. But I'm sure the rehab and protocols to get back to getting onto the field and professional level is
Yep.
a little different from when I was in middle school playing. I used to love sitting behind the bullpen in Seattle and watch the different warm-ups that the pitchers would go through before entering the game. And I've incorporated a lot of them into my own rehabs for baseball players, any really kind of throwing activities that I can think of. But do you have any favorite routines or warm-ups that you would suggest for baseball players to help reduce risk for injuries?
Yeah, I mean, this is obviously a unique thing. It's kind of gained more and more, I think, popularity recently with Paul Skeens and kind of his unique, activation routine that he has with the football, the water bags, and that's kind of, I think, kind of blown up, within the last year or two. Kind of, we've seen more of our players doing these some different unique warm up and activation routines, and pre-game, you get all the kids, everybody will be out watching them. You're just hearing more and more, variations in terms of like what the activation and warm up protocols are because of new things that are coming out, things that kids are seeing people do and all that. So it's kind of interesting to kind of even see just from a warm up and activation routine how that's evolved. But I think for me, like my general approach is I don't believe there's one size fits all for any activation routine or warm up routine. I think those should be individualized, and generally speaking, for me, my approach as a whole is getting the tissue primed and hot, getting the tissue prepared, then moving into some flexibility and mobility work, blending that into an activation, whether that's through the range, isometrically, positional isometrics, in certain ranges, and then adding some speed to kind of prime the tissue and get it ready for things that that you're going to ask it to do. So with that comes into activating your scaps, your rotator cuff, your forearm, your lat, your core and trunk. For me, it's hitting all of those areas that are common injury areas and things that are so highly utilized in the throwing motion, not to mention really any of the hips and kind of lower half stuff, but just specifically thinking, waist up. I think the lat is something that with the growing incidence of lat injuries that we've seen in really higher level like collegiate and more so professional baseball, I think that's often an area where people are not spending as much time on, and it's not just doing rows, lat pull downs, single arm cable rows. It's more so doing positional lat activation or isometrics in various positions in a sports specific fashion, to help to make sure that that lat tendon is stressed at length, and make sure it has the adequate capacity and strength at short and long and medium ranges, to make sure it can endure what it needs to in the throwing motion, because a lat is so heavily utilized in the decel portion or the early acceleration into decel portion of the throwing motion. So for me, those are kind of the bigger picture things of kind of how I look at, of what you need to activate and what you need to do. But really, it's just making sure you get as individualized as possible. You understand, you get evaluated by a physical therapist, by an athletic trainer, by a strength and conditioning coach, to help you to, especially if you're at the youth and high school level, you may not have the access to daily care. It's find out what your individual needs are, what your deficits are, and then help to tailor your activation warm up routine to what those deficits are. And, not just always doing what you see on Instagram or what you may see on TV or things like that. It's really getting as individualized as possible, but hitting each of those different areas, I think really sets you up for no matter what, put you on the right path to hopefully preventing injury and feeling as good as you can day to day.
You brought up something very important that I didn't recall when I first got out of school, but definitely was something that I had to do more research on and look into and saw more and more aspects where it played into it. But your lat, whenever I'm working with the rotator cuff, I think that's one thing that from a cookie cutter standpoint of what are the Instagram or social media exercises for rotator cuff, I think it does get overlooked a decent amount from what I've seen on those kind of trending things. But it is something that as I've incorporated and done more manual work, active release kind of techniques onto there, it makes a huge difference in opening up that rotator cuff. And just in my personal experience, and with your background, you might not have seen as much going in through outpatient clinics. I've done travel therapy where I've gotten to work with a lot of people. And I think that we're always worried about internal, external rotation at different planes. But that's one thing that I'd come in and treat a patient one time that, hey, we're kind of stuck at just this barrier and we don't know how to get it up because we're still getting some of these impingement signs. And then you work into that lat and how much of an impact that has actually had. So I'm glad you brought that up because I think the lat is something that we should incorporate just status quo with every rotator cuff or shoulder injury that we're looking at. And if my algorithm isn't already going off because I'm sitting here having my coffee this morning, I'm seeing all the weighted balls that are coming in there. I love that idea of adding the proprioception to it with the
Yep.
resistance, but also
Yep.
eccentric loading with it. And I think it's a fantastic idea. So definitely recommend if anyone hasn't seen or looked into these kind of aspects of how do I strengthen my shoulder, especially on a baseball or any kind of throwing athlete, definitely valuable information to dive down and ask your therapist about. So I think those are good places to touch base on. Now, besides throwing, hitting is another huge part of baseball that I would love to pick your brain on. I would barely be able to see the ball coming over the plate with how fast pitches throw at a quiet and happy shoulder level in the collegiate and professional level, let alone be able to swing and make contact. What are some techniques you would recommend for improving for hitting? What are different aspects that go into like preparing and strengthening so you can excel at that level of the game?
Yeah, I mean, I think obviously not being a specific hitting coach here and having a little more experience on the throwing side, but I think just seeing what I've seen now with how these hitters and the approach at our analytic group and our hitting coaches kind of do with these athletes is I think, I mean, video analysis is probably the most common thing that's done at the professional level in terms of, whether that's during pregame BP, just during any practice reps, in game. I mean, between at bats, I mean, these guys are doing video review of their prior at bats to kind of see what broke down, what did they feel that kind of led to an out, a ground ball, fly out, or something like that, or if they hit a home run or a good hit, like, hey, what did they do differently there? And then they want to try to, feed that and feed the loop in terms of like how can they get that to translate to the next at bat based on what they're feeling on any given day. So I think the video analysis is huge and being able to break that down into slow motion and kind of, with the help of hopefully, some good individuals around you help to identify, what those, either positive movement patterns are or, negative ones and things that you may need to work on. So I think for me, that's the biggest one that kind of blends into, identifying what your deficits are. If you're not able to get into backside hip internal rotation and that's kind of lagging you around and then you're having to put a little bit more stress or kind of dip a little bit with your trunk, you can't create that motion at your hip that you have to artificially create that with your trunk. I mean, that can lead to a number of movement compensations that might feed a negative outcome in terms of when you put the bat on the ball. So I think it's, the video helps along with some good coaching helps to, identify what your deficits are in the swing, that can give you some different movement strategies or drills. And, again, and then creating those drills or drill packages to help you work on those deficits. So I think that's kind of that loop of kind of being able to feel what you feel, identify, how that translates into the actual swing, identify that on video, and then be able to get some drill packages to basically break the hitting movement down to work on the specific area that maybe you're not creating, as efficient movement patterns. And then hopefully kind of do part practice and then slowly work that back into like whole practice as you get back into the swing. So that's something that pretty much is how things are done here is that whole process there. And that's done with a lot of eyes on each athlete, both inside and outside of the organization to help to develop what those drill packages are and, to give the right types of feedback, to each player. And these guys at the highest level, I mean, they've done it, they've had success, they've not had success. I mean, they've worked through a lot of things. So it's figuring out how to get the buy-in, with those athletes and, to make sure that you can, be able to give them the right type of feedback and, but video review is probably one of the biggest things. And I think, at this level, consistency is probably the biggest key to anything, especially in a sport where it's an overused sport. It's something where guys are playing almost every day. I mean, consistency in your swing, consistency in your delivery. When you're doing the same thing so many times, it's like you have to have consistency in what you do, or else, with something where it's, with how, like you mentioned, with how hard it is to hit a 95 plus mile an hour fastball. And we have some players in the major leagues throwing up to 104, 105. I mean, that pitch comes in so quickly and you have to make such split second decisions. So it's like being able to, have some consistency in your swing and being able to do things and time things and sequence things so well every single time to be able to have a positive outcome, I think is extremely hard to do. But consistency to your craft and what you do is, as in anything in life, but specifically just thinking to hitting is so important. And, I think visualization is key. Our mental performance department does an awesome job with mental like visualization, putting each player in different situations, maybe in a situation where, they seeing an off-speed pitch, kind of reading that, doing some different visual work like that, I think is, and helps to slow the game down, when you're actually out on the field. So that's something that our mental performance department really helps to assist with. And working on hand-eye coordination, a lot of different implements, doesn't always have to be baseball specific. I mean, it can be some form of juggling games, even something like spike ball will have guys play, just something where you're working on hand-eye coordination and just the quickness of movement and how to read the ball and read different situations. I think is something that, especially at the minor league and into professional level, is kind of gaining more and more popularity to really get some variable training in that kind of makes things fun a little bit and is something a little different than just hitting every time, but it's something that can obviously train some good prerequisite skills to give you that visual cognitive ability to be able to see the ball and, hit the ball at a very, very high level. And then obviously using different implements, golf balls, wiffle balls, tennis balls, small bats, skinny bats, light bats, heavy bats. I mean, all these different implements to basically give you some variable practice. So when you are trying to do what you want to do, it's like you over constrain, under constrain. You train with heavier, lighter, smaller, bigger. So, that allows you to just have more movement options, movement strategies, and just ability to adapt, in the moment, when you're trying to hit a 100-mile-an-hour fastball. So those are probably some things that I think I've kind of seen and learned and everything, kind of being, at the professional level now for 5 years.
It's got to be. I always think of baseball as the most analytic sport that you can go through, where it's so fast paced. I'm so glad there's a replay where you can slow it down because I miss it. I blink and I'm like, what just happened? It's the next inning.
Yep.
So,
Yep.
and I use that too. Like we're doing gait analysis just to be able to break down, slow down movements. But part of our job, one of the coolest parts I think is we get to be detectives. We get to kind of see something's going on. No one can figure it out. We get our eyes on it and we can break down different components and really see, okay, these are elements that let's try this. How is this affecting your movement patterns? What's dysfunctional about it? So I
Right.
always love using like, hey, let's get you running. Let's actually see you doing the activity that's giving you issues to be able to do that. I'm sure baseball and hitting is kind of the ideal purpose of being able to see all those landmarks where you're looking at the ball trying to make contact with the bat, but you got to look at the whole body. What's moving, what's not moving, what's compensating. So I think that's really useful stuff to know and dive into there. And then I got one last question for you for the day. And I always love doing this to other therapists because it's like the patient coming in being like, what's that one exercise I have to do to fix all my problems with it? And that's not what I want to look at for this, but I want to get your true insight on baseball involving throwing, pitching, running, sliding, and having to make split-second decisions. What are some types of exercises you like to implement and that you would recommend PTs to consider including in their treatment in baseball players that can, and even if it's like, hey, go down the line, apply metrics or the agility, what you're saying, the coordination with it. But this is more geared towards the physical therapist. So certain things that they might be missing in the clinical setting that might be helpful or open up doors where they're going to excel better in their rehabilitation approach.
Yeah, I mean, I think obviously keeping it a little general, to start with, but I think your, integration of your scap, your rotator cuff, that lat specific training, like we talk about, is short and long length, trying to make things as sport specific and task specific as possible, I think is something that's extremely important that I don't think, in my experience, a lot of clinicians will typically utilize within their preventative and, rehabilitative programs that I think is a huge missing piece, just given the increased incidence that we're seeing of lat injuries, and also even with just with the manual therapy, like you mentioned. I mean, you get a post-operative shoulder. I mean, you do some active release or some work into the lat. I mean, you can open up, some external rotation, some ranges, overhead flexion that, maybe they were kind of stuck with it, is an area that maybe people, that I've seen don't always hit. So I think that the lat is a huge piece that I think I've grown to appreciate and work with, a lot more, both from a manual therapy standpoint, but also from an exercise standpoint. And then I think that also blends into something that you don't, that I think is maybe not utilized as much sometimes, but it's the tempo and RFD based exercises. So your different ball drop, like your weighted drop ball exercises, your catch based exercises, like your TRX, like if you have a quick, just to kind of more like force absorption, something to kind of absorb force quickly, your banded tantrums, your forearm strengthening with a specific emphasis on FDS, FCU, and pronator. Those are the three muscles that are the most protective in the literature over your UCL. So basically, how I think of every time I do form exercises with a player, with a post-operative athlete, like I have specific integration of finger flexor, of ulnar deviation, and of pronation through a variety means of end range, mid range, short range, isometric, isotonic, eccentric variations, speed, tempo base. Like those are all variations that I want to make sure that are specific to the sport, and that I make sure I target and prepare those athletes for. So when they do get back to sport, both short and long term, that we have a good seamless, kind of return to play, transition. So I think making sure you hit things not only at short and mid lengths, mid ranges, but making sure you get athletes to their end ranges, shoulder, forearm, whatever it is, lat, overhead flexion, you get them to their end ranges and ask them to contract. And you can really get a sense on some guys of, what their end range control is. If you put them in their end range, obviously guys are going to be weakest at their end ranges, but if you put somebody in their end range and you can end range external rotation on the table and you can easily lift them out of their end range, it's like, all right, and this player also has 115 plus degrees of ER. It's like, all right, you probably have an end range control problem. We probably need to add some end range exercises, but and that's just something I think I've seen just that, maybe clinicians aren't utilizing or adding, enough of. That's something that I think I've really gained in a specific appreciation for. And then I don't know if anybody has taken the Sportsmith isometric course. It's really that's was really created by Keith Barr. He's kind of one of the isometric kind of gurus out there, if you will. But I would say utilization of isometrics is probably one of the biggest things we do at the professional level. Positional isometrics, through rehab, starting early with your 4 by 10 seconds, building up to 30 seconds, learning to, getting to do it 1, 2, 3 times a day, 6 hours in between. Like that course gives you the full breakdown of how to really, really utilize and implement. And it's it's an online course and it's pretty cost effective as well. But really gives you a great rundown of how to utilize and implement, run specific, throwing specific, all isometric programs and protocols kind of into your rehab, both preventative and, post-injury or post-operative rehab. I've gained a huge appreciation for the role of isometric stuff that you don't really learn about at school and in school, and something that I didn't really, even get earlier on, in my career. But again, like I said, just have a huge appreciation for now. So, I think that's kind of, really blended and kind of impacted, the care that I provide, to the athletes that I work with.
I love how you summed that up. It was one of those things I remember asking in school. We do manual muscle testing. We're just trying to figure out the strength of it's a static position. Anyone that goes to a PT clinic or get assessed, you're going to find out what I mean by that. But I remember asking a question one time, like, they're really strong in this range, but not in this one. And it's some of the most valuable advice, and it has stuck with me ever since, is you're only as strong as your weakest link. So I think people get discouraged sometimes. They go to PTs, we're like, hey, I'm doing that exercise, I look great. I'm like, all right, I really don't care anymore about that exercise. I want to look into your impairments, the areas where you're dysfunctional, you have that weakness. So whether it's the isometrics, working on the different phases of it, holding that, working more on the tendon versus, oh, we just have to get that range of motion. So I think that there's one thing to kind of accomplish. We have that range of motion, check. That's what the insurance is going to look for. We have the strength and all your rotate, but how does it apply and how can you actually sustain that strength to get you back to the activities you want to do? So that's a lot of really good information there, and I appreciate that. I haven't taken that class, so that's definitely on the list now to do. So you're adding more to my to-do list here, Luke. I love it.